Okay, and Robyn, when did you get your breast implants?
I was diagnosed with breast cancer in 2017, and I chose to have a double mastectomy. And I had reconstruction with tissue expanders and then breast implants.
How soon after that did you start experiencing symptoms?
I actually got sick right away, literally within the first week of having my implants. It started with migraines, headaches, heart palpitations, anxiety. By the second and third week, I had skin rashes. My hair started falling out. I had joint pain. I had insomnia, and my health just really declined after getting the implants.
And so what were you thinking? Like, it couldn't have been implants, right? Such weird symptoms.
Well, exactly, because none of my doctors told me. And as a breast cancer patient, I had a whole entire team of doctors, and nobody told me that my breast implants could make me sick. So, interestingly, I didn't do chemotherapy or radiation. So, it couldn't be blamed on treatment. Most breast cancer patients that I had been talking to were saying, oh, yeah, I have all that from chemo, but I didn't do chemo. So I couldn't understand why I was so sick. And, my health just declined so rapidly. And I actually met another breast cancer patient who told me she had a breast augmentation and she had been sick for 8 years and decided to take her implants out. And she felt better immediately after taking them out. So after hearing her story and asking her, what her symptoms were, I could literally check every box of all of her symptoms. So that's when it really resonated with me that it could be my implants. And, at that point I was so miserable. I only had them in for 4 months. And I just thought, if I can get my life back and take these out, I'm going to do it. And I did. And I honestly felt better immediately as soon as waking up from surgery.
Other women I've talked to go years not knowing the cause, what to do, because, like you said, there's no standard protocol to let patients know about the dangers. So yours was a relatively short period of time. I don't want to dismiss what you went through, right? It was still horrible. So 4 months, you got them out. So also in 2017, I just want to get my timeline correct. You got them
Yes.
out, you felt better. And then what, Robyn?
So I was actually shocked at how good I felt after having them removed. And I was excited and elated, to get my life back. But at the same time, I was very angry and I
Right.
felt betrayed. I felt betrayed by my whole team of doctors that nobody told me that this could happen. And, I had a lot of emotions at the time. I was angry. I was happy that I felt better. So I actually just decided to become a patient advocate and start trying to let other women know that this could be happening. And I also went to my state capital and worked on implementing legislation to make sure that surgeons are giving patients proper informed consent about having breast implant surgery, whether it's for an augmentation, cosmetic reasons, or for breast reconstruction after cancer or even a birth defect. Women deserve to have all that information up front so that they can make an informed and educated decision.
When did that
Turn the lights back on.
Oh, okay. When did that legislation and what is it called go into effect in Arizona?
On January 1st, 2022, it went into effect, and it's informed consent for breast implant surgery.
And what does that entail? If I want to get breast implants, I come to you as my plastic surgeon. What do you, Robyn, have to tell me?
So the plastic surgeon have to give you the patient information booklet that is supposed to come with every set of breast implants. And they're going to be required by law to give that to patients. And also a patient decision checklist that we developed that outlines the risks in layman's terms that patients can understand. It also goes into detail about the systemic symptoms that women are experiencing after getting breast implants, and also the cancers that are related to breast implants. And we kind of go into the autoimmune diseases and what those diseases look like, what the symptoms are, so that women, like you said, you've talked to so many women have been chasing a diagnosis or some kind of answer for years, even decades. And, we are all about women having choices, but it needs to be an informed choice. And then if they do get sick, they know the information that it could be caused by their breast implants. And then they can take measures to either have them removed or talk to their doctor about what their options are.
Robyn, you've been an advocate for this for years now. Can you tell me why there is not an official medical diagnosis for BII? That's shocking.
It is shocking, especially since breast implants have been around for 60 years and they've been making women sick for 60 years. They were also banned in the early 1990s for over a decade. And for all of these reasons that we've just discussed, systemic illness, systemic symptoms. And so to answer your question, I'm not sure why they're not letting patients know. And it's kind of been a well-kept secret in the plastic surgery community. You know, in 2019, we found that the FDA was hiding over 446,000 reports of women who were harmed by breast implants. So the information is not getting to patients. And we meet regularly with the plastic surgeon societies, you know, to kind of share with them what we're seeing on the patient side. And, you know, they're very confident that patients are getting this information. Yet I have a survey with over 5,000 respondents, and 84% of patients said they never got this information. 96% of patients said they never even understood the risks, complications, and maintenance of having breast implant surgery. They're not lifetime devices. If you get breast implants, you're signing up for a lifetime of surgeries, revisions, and multiple procedures that cost money, and insurance doesn't cover typically.
I did find that on the FDA website. It does say these are not lifetime products, but okay. So, but Arizona residents, you know, have that law to protect them. Is there any other state that has a similar law?
No.
Oh, Arizona is the first and only state in the country with
Yes.
informed consent. Okay.
Correct.
What is your mission now, Robyn?
Our mission is to continue to raise awareness and to continue to pass not only state legislation, but federal legislation that protects patients and informs patients. And just to make sure that, you know, we're holding the medical community accountable and the FDA accountable for making sure that breast implant manufacturers have proper labeling and proper informed consent. You know, in 2022, they announced several cancers that are caused by breast implants that develop in the breast implant capsule. And that was announced by the FDA. And here we are in 2024, and the FDA has not required manufacturers to update their patient labeling. So last year in 2023, 400,000 women got breast implants without proper informed consent.
What is label information? What are you specifically talking about?
So when you go to a consult to have breast implant surgery, the doctor is supposed to share with you all the information from the breast implant that will be used in your body so that you can look over that information, see what the risks and complications are, see what the benefits are. And by federal law and by FDA standards, the manufacturers are supposed to provide all that patient information in their patient labeling. And so far, here we are, 2 years later, and the FDA has not required manufacturers to inform patients of those safety updates.
What was the update that we saw the FDA do in December?
I'm not sure what that FDA update was. I think they were just reiterating the standards for maintenance, maybe, and screening procedures. I would have to look at that.
So, is the FDA doing enough to protect women who want breast implants?
They are not doing enough. We have actually been asking them for over 5 years now to issue a healthcare provider letter to all medical professionals so that every practitioner is aware that breast implants can cause cancer, systemic symptoms. And we have not been able to have the FDA issue that letter. And that letter is very important because these women, as we talked about earlier, they're going to so many different doctors trying to figure out what the root cause of their health problems are. So if they're going to a neurologist because they're having chronic migraines 3 to 5 days a week, and that neurologist doesn't know that breast implants can cause that, they're just going to be chasing their tail. So if the FDA could issue that letter to all healthcare providers letting them know these safety updates, then practitioners can be aware of that so that they can better help patients and that they can make diagnoses in a timely manner and get patients the help that they need. I actually posted something on LinkedIn, and I had a woman who worked at a breast center. She was a breast care specialist, and she had no idea about the FDA safety updates. Nobody told her. And she's a breast specialist. She was very upset. And so, we had an online conversation about it, and it just really made me realize there's such a disconnect here, and there's such a lack of information in the medical community. And the FDA has full capability to issue a letter like that to inform practitioners. So I would love to know why they haven't done it yet.
Well, you've been in conversation with the FDA. What did they tell you?
They told us that they think they're doing a great job communicating safety updates. And in an email that they sent, they told us that that safety update was viewed 50,000 times on their website, 50,000 times on their YouTube channel, and that they sent out 220,000 email subscriptions that people sign up to get safety updates. But I'm thinking that's only a couple 100,000 people that saw that information. And I went and did some research and found out, we have over 1 million licensed active medical doctors in the United States and 3.8 million practicing nurses in the United States. So almost 5 million medical professionals, and the FDA communication reached a couple 100,000. So we're really missing the mark there, and I know they can do better.
I think there was also talk about a lack of standard of care for BII patients, right? Not only do medical professionals can identify it, they can't prescribe a treatment. What do we have to do to make that a reality, Robyn?
I think it's just awareness. I think it's public awareness and medical community awareness. Unfortunately, the plastic surgeon community is very divided in breast implant illness and what the standard of care should be, what is appropriate, what's real, what's not. We are still hearing practitioners say and plastic surgeons say that, this is a social media triggered disease, and, that patients are sensationalizing their stories. And I wasn't even on social media at the time that I got so sick. So there's no story out there that I even saw that would put those ideas in my head. So, I think trying to convince the plastic surgery community is just a moot point at this time. And it's really just getting public awareness about this.
Do you have any part in them starting the nonprofit and raising awareness down here in Austin?
No, I fully support them 100%. I have a lot on my plate, and I'm stretched in many different directions, but I'm definitely aware of it. And I think it's amazing that they're, raising awareness about this for sure.
As a patient advocate, what are you doing? How are you spending your time to raise awareness about BII?
We do a lot of social media campaigns where, we'll make posts with information, safety updates, FDA communications, and really just helping patients. I help administer several online support groups and talk to patients on a daily basis. I even go to consultation appointments with ladies locally who are meeting with their plastic surgeons to talk about their breast implants. And really just working with other organizations and state legislators to get laws passed, and working with women all over the globe that are doing the same things that we're doing and helping them connect with the right people to just kind of share this awareness. I think just really I want to hit home that the manufacturers are not being held accountable for their products. And the FDA is lacking in letting the medical community know about the dangers of breast implants and the symptoms and cancers that are caused by breast implants. We would love to see public service announcements that are put out, kind of like we saw during COVID, just to let patients know what they can do, how they can keep themselves safe, and who to contact if they have questions, what questions to ask their medical providers, and then really just letting medical providers know that these things can happen with breast implants, and to do simple things like include it on your intake form when you're registering patients and say, do you have an implanted medical device? Do you have breast implants? Because it's not just breast implants that cause these problems. We see it with other medical devices as well. So it's really just about being knowledgeable and informed and having all of the information that the patient needs to make an educated and informed decision.